So we recently spoke to people at McMaster and asked for their opinions regarding certain issues in the association between gender and health. Here are some of the responses we came across.
Where do you think most of the focus lies? Women's or men's health?
Neither.
I think most of the focus is on women.
Probably women. I don't know.
I think it's going into both, no?
Canadian healthcare focus is different in the sense that we have separate issues for men and women. I wouldn't say that one is more focused than the other.
I think the focus on healthcare is pretty even.
It's pretty clear, women are expected to live longer, and what I guess contributing to that is the social influences that are pushed onto women a little more. It's okay for the guy to go home and drink a beer after work and sit on a couch and almost admired by his peers, where a female, more likely to go to the gym.
I believe there might be a little bit more focus on women's health, just with all the things with breast cancer screening as well as cervical cancer.
Well, I think a lot of the research that is used to treat both men and women is based on research that is done on men, so regardless of where the focus is, women are receiving treatment as designed for men.
Recently, gender has been recognized as having an important impact on health. Why do you think that is?
So single women that are single moms might not have a lot of money because they're going to support their kids, so they might have a problem with their health.
It could be the way that the doctor-patient relationship is structured between men and the way the doctor-patient relationship is structured between women. And just based on the differences in how women portray their symptoms to doctors, they may get tested differently. Also, women present differently, men present differently, and so doctors may be inclined to do specific testing based on those symptoms.
Gender is a determinant of health because it has underlying social implications for the role of people in their income. If you look, for example, at women's income for the same job, it's still lower. It's still 80% of what most men will earn in Canada. And it's also determined in terms of access to resources.
I think female are more healthy because they're more prone to go seek help. They're more prone to go to the hospital to get help, check out their health issues and everything. Where males are they're more they have their pride. They don't really be oh, I'm healthy. They don't really want to go get checked out.
What do you think are some global health concerns for women?
Right now, this whole increase in Africa with the AIDS, with the prostitutes.
Breast cancer, it seems to be quite prevalent, and we're seeing more and more of it.
Breast cancer?
In certain countries of the world where women are at home a whole lot more and very poor, the only way to have income is prostitution.
In terms of a global perspective on it, there are huge issues with women accessing health care in developing countries, and I think that it's recognized because we come from a society where women are much more empowered than they may be, for example, in Yemen, where you have a birth rate of seven children per woman and no access to health care. So access to things outside of the standard health care, like midwives, things like pharmacists and people other than direct physicians, I think there's a huge gap there.
What do you think are some important health concerns for women in Canada?
Cardiovascular disease, breast cancer, anything.
Women's health in regards of maternal and fetal medicine is very important, high-risk pregnancies, things of that sort, reproductive technologies, things of that sort, and I also think just breast cancer.
Well, right now in Hamilton, there's a big increase in type 2 diabetes, and especially for women living below the poverty line, it's really difficult for them to access primary care.
In Canada, it seems as if some cancers are stereotyped to one gender only, which isn't always the case.
Access to birth control and abortion. In a lot of places it's simply not available. We are guaranteed the right to an abortion, but if there's no doctor to provide it, then what's the point of that right? So if you, for example, you live in PEI, if you live in the territories, I'm from northern BC, I couldn't get an abortion in my dad, I would take a bus for 10 to 12 hours to Vancouver. So I think that has an impact on my reproductive rights, on my overall health care, and just on my life as a woman.